season is going full force, and a new warning from the Centers for Disease Control indicates this year's vaccine may not be as effective. As reported Thursday, the government agency notified doctors that this year's vaccine may not protect against the most common form of the virus making the rounds right now. They say the H3N2 strain has mutated into a different version not included in the vaccine. But health officials say it's still important to receive it. For more on this development, we're joined by Dr. Edward McBride, the Vice President of Clinical Services at Summit Medical Group. Dr. McBride, it's good to see you.
Good to be back. Thank you.
It seems that it's oftentimes a guessing game when it comes to the development of a vaccine. Is that indeed the case?
It is, but it's more of an educated guess. It's not a blind stab in the dark, so to speak. We actually know what's been going around the globe in other areas throughout the last season and over the last 12 months. And based upon that, they formulate a vaccine which takes months to develop. You can't do that overnight, so we have to make an educated guess on what we anticipate will be circulating in the coming season. They did so this year. That guess was slightly off the mark.
Yeah, as I said, it mutated. Is that a common situation to happen typically?
Indeed it is. You know, the virus itself will change over time. We call that drifting, meaning it moves off of what it had been before. You know, the vaccine is still protective. There are a lot of other strains that continue to circulate. The H3N2 that you referenced is the primary viral type that's circulating right now, but even that can change over the course of the season. So there's still some protection in that vaccine, and it's your best bet at preventing the infection.
Is that primarily what we're seeing as far as in the Knoxville area, the strain of the virus right now?
The good news is last I checked, our viral activity is low.
Good.
Here in this area. Now, border states are actually tick in the number of cases that have been diagnosed, and with travel, with the holiday season, I would anticipate that our cases will climb over time. There's something called herd immunity. If enough of us actually get the vaccine, it protects one another. So there's a lot of reasons to get the vaccine still.
Let's expound upon that, because some may think, just in listening to this, well, if it doesn't cover this strain, what's the point? There is a great point in getting it.
There are. You know, the folks that are most susceptible to not just influenza, but also complications of influenza are those with chronic illness, those with chronic lung disease and others. There's a lot of protection from influenza in the vaccine itself, and then there are also other vaccines like the pneumonia vaccine that those folks should consider getting if they're at risk.
A lot of folks are adverse to getting a shot, but with the flu vaccination, you can get it in another means that is maybe a little more palatable.
Well, there is the nasal vaccine as well, and that's an option for many.
Exactly.
There's also a new high dose for elderly folks. It's improved for age 65 and up now. That's actually a stronger version of the vaccine that other folks get. Boosts the immunity slightly over what you get in a standard vaccine, so some additional protection there. And then for those who actually do get the influenza virus and come down with it, there are some medications to which that virus is sensitive. So we do have some good medications to treat, and the CDC's made some recommendations as well within the last week, and they're similar to what they have in years past around what best practice would be for physicians prescribing those.
So, point of the matter is, still get a flu shot.
Correct.
All right. Dr. McBride, thank you. We appreciate you being with us today.
It's my pleasure. Thank you.
And we will be right back. Stay with us.